Hey guys, I'm Dr. Latif Nurudeen, foot and ankle surgeon based out of Houston, Texas. I wanted to briefly touch on the Calvin Ridley injury from the Thursday night football game between the Panthers and the Atlanta Falcons. So, typically with guys like Ridley, Amari Cooper, Jerry Jeudy, these guys that their game is based on speed, separation, and explosion, and mainly route running. Route running, you obviously predicates itself on explosion, planting your foot really hard in the ground, and stopping and starting on a dime. So obviously foot stabilization is important. So the injury to Ridley, essentially he's running a 15-yard dig route. He gets to the top of his route, gets great separation on the DB. The Matt Ryan ball kind of slows him down. So when he catches the football, defender's basically on his back already. He gets tackled. His foot jams into the ground, plantar flexed. Defender kind of lands on his heel a little bit, jamming his foot into the ground. Now, I know the NFLPA which is the NFL Player Association, they've had a real issue with some of these turf fields, and you kind of see a lot of these injuries on these turf fields, which I believe is what they were playing on last night. So he gets his foot jammed into the ground. There's no give, obviously, with turf. His cleats get stuck in the ground. Defender lands on his heel and essentially injures this Lisfranc ligament complex. So that Lisfranc ligament stabilizes your entire midfoot. So for guys like Ridley, guys like Jeudy, these quick, explosive guys who pride themselves on route running, stopping, and starting, that kind of injury is detrimental. So it's very similar to the Cam Newton injury from the preseason from last year when he was with the Panthers. Ironically, they were playing against the Patriots. So as you can see with Cam, he tried to play through it. He couldn't run, ended up opting for surgery. So not saying that that's what's going to happen with Ridley, but in my experience, that's typically what you see. Athletes try to play through it. They try to get through it. They say, well, the complex can heal on its own. But ligaments hold two bones together. So for guys like Ridley, because that ligament does hold those bones together, it's very important to the stabilization of his foot. He can't play his game with an injury to that ligament. So I wouldn't be surprised if Ridley was down for the year. And it's really tough timing because he was really coming into his own, looked a lot like a #1 receiver. So here's for a speedy recovery to Mr. Calvin Ridley and all the Atlanta Falcons fans. I feel for you. It's already a tough year. I believe they're 2-5 or 2-6 right now, but the good thing is that if he does have the surgical procedure, he can get back to himself by next year. All right.